The biggest concern in a white turgid cataract is that the rhexis can run out, causing Argentinian flag sign. Techniques have been developed to reduce the chances of Argentinian flag sign. The current most popular technique is to give a puncture in the center of the capsular bag and let the cortical fluid escape. This causes a little decompression of the capsular bag, and then a small 3 mm rhexis can be made. Once this rhexis is complete, the battle is almost won. You can now do hydrodissection, keeping the nucleus pressed so that the fluid does not collect behind the nucleus, as retronuclear pressure could rupture the posterior capsule. By dialing the nucleus, it becomes easier to decompress the bag. And once the bag is decompressed, you can comfortably give a small nick in the rhexis and enlarge the rhexis with the forceps. This technique has really reduced the incidence of the white cataract rhexis from running out. However, there would still be certain situations where this technique may not work. Like in this situation, the moment we made the puncture, we had the Argentinian flag sign. So then it was postulated that in a white turgid cataract, the maximum pressure on the capsule is in the center of cataract. So if you enter the capsule from the mid-periphery with the needle bevel up and then aspirate a little bit of cortex to decompress the bag, then it is safer to make a small rhexis. However, the risk of keeping the bevel up was that the tip of the needle could touch the anterior capsule during suction and cause the puncture. So, the next step was to keep the bevel down and keep the nucleus pressed. Do a little suction and decompress the bag, and then do what is called the Flap-Rhexis technique. In this technique, instead of cutting one edge of the capsule, we lift two edges of the capsule in the form of a flap. The advantage of the flap is that you have control over both the edges of the capsular flap, and the rhexis do not tend to run out. And once you cross the mid-center about a millimeter, you take the control of the outer edge of the rhexis and turn it around to complete a small rhexis. The next consideration was for how long to decompress the bag. It is important to know that decompression should be very short, because if you keep decompressing the bag as you are seeing it now, then the liquid cortex, which acts as a buffer between the needle and the anterior capsule, reduces, and there is a risk that the needle may hit the anterior capsule and cause a tear, which has happened in this case. However, since the capsular bag had been decompressed, it was not much of a concern, as you could still do a safe microrhexis encircling the capsular tear. Thank you.